Back to Sunday Live here at Citizen Television. We managed to get our interviewee, Vicky.
Indeed, we did. Let me introduce him really quickly. Francis Ndwiga, lead for the Community-Based Prevention of Mother-to-Child Transmission Program at NASCOP, as well as Principal Chief Officer in the Ministry of Health. Francis, thank you so much for joining us. We heard some good news in the report by Marianne in terms of global numbers. The transmissions have lowered, but what's the status now, at least for Kenya? How many women are dealing with HIV while pregnant? And how are you dealing with those numbers?
Okay. Thank you very much, Jeff and Badiri and the viewers for giving me this opportunity. Really, as we talk now, is that our projection in terms of the number of people that really are pregnant, estimated number is 1.7. It's about 1.7 million people. But on top of that, what we are saying that in terms of the program performance, we are really doing well in terms of the interventions that are there, looking at issues around universal access to comprehensive issues around the MCH, issues around looking at improving here in terms of program, is that the program currently is at around a transmission rate of around 10.8. Children are infected with HIV, reduction from the performance of 2019, which is 12.4. So currently we are doing well, but we cannot say that we are really at where we want to be. Still, the burden of HIV in Kenya still remains very high.
Francis, it's Jeff. When you talk about the availability of ARVs, there was an issue a few months ago, the availability of ARVs. Has that been resolved, or do you think HIV/AIDS has taken a back seat to corona?
Currently, we cannot say. We are in a dark state in terms of the two diseases, and we cannot say any of them is better. What we are saying is that the government is putting effort to ensure that both diseases can also be controlled at the same. One of the key things that is very important with the two conditions is that there are lessons that we are running that will complement the two in terms of control of the two virus in this country, and which are very critical for us to be able to borrow those lessons and ensure that we can be able to come up with the solutions that are home-based, or what we can say that homegrown solutions for the two in terms of controlling this virus. So currently, what we are saying is that we may be having some challenges, but we are putting effort to ensure that the effort that we are putting will be able to control the two diseases at the same time, as much as one may affect the other, but the control measures are in place, and we are trying our level best to put our effort in that.
All right, Francis, and it's already been established how critical ARVs are when it comes to treating HIV and AIDS. But in a practical sense, what other preventative measures are being implemented now to ensure that fewer and fewer mothers are passing on the disease to their children?
Okay, one of the things is that currently what we are doing is we are having different interventions. One of the interventions that we are putting in place is in terms of behavioral prevention measures. That are issues around ensuring that we have healthy messages that are fully within the component of either family planning and also even in terms of provision of family planning. The other one is the issue around testing. We are putting effort to ensure that all mothers are tested and they are able to know their status, and if they test positive, we are able to start on ART. The other one is the issue around biomedical interventions, that's looking at issues around initiating our mothers and children to ART. That is mainly focusing on mother on heart, and also issues around infant prophylaxis. The other one is that we cannot ignore the component of nutrition, which is very critical, especially ensuring that we can be able to do better counseling for especially exclusive breastfeeding, and also looking at how we can also be able to maintain diet for that. Early infant diagnosis is also an intervention that is very critical for our children to be able to know their status, and also issues around ensuring that our ANC mothers during pregnancy, they are well tested, they know their status, and they are well maintained within the care and the component of continuum of care as they move towards the gestation period that we really are focusing on to ensure that they get quality of care within that period. That's what we are doing.
Francis, you heard that story about Beatrice Kabugi, an HIV survivor. She was explaining how the child starts taking ARVs soon after breastfeeding. Will this be for the rest of their lives?
Repeat, Jeff. I can't get you clearly.
The ARVs that the children start taking after breastfeeding, is that for the rest of their lives?
Yeah, actually, what we say is that most of the time, in terms of initiating ART, is a long life. We saw people live with it, and it's very critical to ensure that we maintain them on care. One of the key components that we're having as a challenge is really to retain them on care and also ensuring that adherence is taken care of. So one of the key things within that is that we need to do a lot of education in terms of literacy of these mothers to ensure that they are able to understand that some of these ART that we give to them is a long life kind of a treatment that we give to them. That's true.
All right, and I guess the whole point is putting them on life-saving treatment so they have at least a fruitful life to look forward to.
Yeah.
Absolutely. Thank you, Francis Dwiga, for that. Let's switch gears now and